Hey, hearty welcome everyone to another super informative episode of the MedX series, and it's titled I Care in Diabetes. Extremely important. We all know diabetics do get their eye affected in different ways, and I'm not going to be talking much about it because we've got a super expert with me who is 9 years senior to me from BJ Medical, who's also an MS and DNB in ophthalmology and currently the president of the Maharashtra Ophthalmological Society. So let me welcome with great joy and great heart Dr. Santosh Bhide on screen. And yes, thank you so much for coming on the
Namaste.
show. Yes. So without much ado, Dr. Bhide, you've been practicing already for 30 plus years since 1992 at Jangli Maharaj Road and many hospitals in Pune. You've seen so many diabetics in your life. You've seen their eyes inside out. I can see also one eye image of a diabetic behind you right now. So very briefly in this particular talk, what we'll do is just understand some of the top three problems that they should watch out for and then some remedies and all later. So first question is, what are the top two, three things that diabetics should watch out for with all the experience that you have, you want to share with all of us?
So, before we come to top three things which we should watch, what I have seen in last 30 years of my practice is that there is a changing trend. 30
Uh-huh.
years ago, the number of diabetics and the number of diabetics which we are detecting now, there is a vast change. In
Okay.
fact, India is becoming a capital of diabetes in the world. And
Yes.
that is because of our change in lifestyle, our change in diet, and our change in professions also. We are doing more chair sort of jobs, less exercise, and improper diet. And
Correct.
I know that you insist and you give a lot of importance on proper diet also. With that, the three most important things, since you have asked only three, there are many important things which happen in diabetes. The most important thing is diabetic retinopathy. As we all know that retina is the most important part of our eye. Just to explain, our eye is like a camera.
Hmm.
So, and retina is like a film of the camera. So
Correct.
if that film gets damaged, even if the image is formed on that film,
Hmm.
that will not be visible to our brain.
Correct.
So diabetic retinopathy is the first thing. Second thing is diabetic cataracts. We all know about cataract. These are lenticular changes, but in diabetics, they get cataract at earlier age and slightly different also. And third thing is that diabetics also have high chances of development of glaucoma. And
Hmm.
most of the patients or most of the common people are unaware of glaucoma.
Hmm.
In Marathi, we call Kajbindu for
Hmm.
glaucoma and Motibindu for cataract. And most of the patients feel that Kajbindu and Motibindu is just the same, but it
Hmm.
is totally different.
So let's
So
say if you see 100 patients, 100 diabetics, just for people to get a gravity of the problem, how many of them you see having retinopathy? How many of them develop cataracts? How many of them develop glaucoma? Okay, out of 100 patients that you see, just a broad thumb rule experience that you have for people to get a gravity. Yes,
basically, it all depends on the number of years of diabetes. Suppose a
correct.
patient is detected of diabetes recently, or he
Hmm.
has diabetes only for 1 or 2 years, then that patient may not have diabetic retinopathy.
Correct.
But if patient is diabetic for more than 10 years,
Hmm.
then the chance of development of diabetic retinopathy is very high. It is almost more than 30% of such patients do
Okay.
have some sort of diabetic retinopathy.
Okay.
And if the diabetes is not under control, the second factor is control of diabetes. Some patients have diabetes under control. They do have diabetes for long duration, but under control. In
Correct.
such patients, usually such complications related to diabetes are less severe. I will not say that those complications are not seen, but those complications are less severe.
Okay.
And there is another most important factor is like a genetic factor. There
Okay.
are some people who are genetically predisposed to develop complications of diabetes,
Uh-huh.
while certain patients are genetically, let's call
Protected.
them, immune of not getting complications. I have also seen patients who are diabetic for 25 years without any diabetic retinopathy. And I
Mm.
have also seen patients who have diabetes, which is detected 5 years ago. So they have severe diabetic retinopathy. So it is a multifactorial. So one must understand that these are different factors which are responsible for development of complications due to diabetes.
So what you said was number of years of diabetes, sugar control, and genetics. But the audience always loves numbers. So let's say if you have seen 100 patients who have some problem related to diabetes with with these three things, less or more for each one of them, like out of those 100 diabetes patients, how many of them would be retinopathy? Okay, let's say 60 or 80. How many of them may be cataract? 30 or 50, or glaucoma, 5 or 10, just to for the audience to get a grasp of it that way.
As you are aware that medical science is not like a mathematical science.
I know.
Though the patients like to listen to numbers and then they stick to the numbers. So I'll be a bit non-committal in this fact.
Okay.
Because it is not that all patients who come with diabetes, they have only diabetes. There are some patients who have hypertension or blood pressure also.
Correct.
So those patients with diabetes and blood pressure, they have more chance of development of retinopathy. And that retinopathy will be diabetic as well as hypertensive retinopathy.
Correct.
So
Correct.
it is not a water compartment that, okay, this patient will have only diabetic retinopathy. This patient will have only hypertensive retinopathy. This will not get this thing. It is nothing like it. It's all interlinked.
Correct.
But to make it simple, I will tell again, if patient is recently diagnosed as diabetic, then the chance of development of diabetic retinopathy is much less. Let us say that if the diabetes is detected less than 5 years back, then the chance is pretty less. Let's put it to satisfy numbers, let's say less than 5 to 10%.
Okay.
But if it is from more than 5 to 10 years, percentage goes on increasing. And if diabetes is there for more than 10 years, and if that is an insulin dependent diabetes, then the severity of diabetic retinopathy and incidence of diabetic retinopathy varies to as high as 60% also. So
Oh my
let's put
God.
it 60%.
So amongst the three, which is most dangerous, retinopathy or glaucoma? Cataract or thick, I think is simple. You remove the lens, put a nice lens, and people start feeling younger. In fact, I remember my aunt saying once, कि मैंने इतना डिले क्यों किया? Why did I delay so much? तो मेरे को जवान लग रहा है. I'm feeling younger after putting the cataract lens. So cataract relatively simple to handle is what common people think, and of course, you're the expert. You can
But then
from
again,
that.
I will throw light regarding cataract also. So cataract in a diabetic. Again, as I said, it is not that that patient is having only cataract.
Correct.
Patient may be having diabetic retinopathy behind cataract, and that cannot be seen because of the density of cataract. So once we remove cataract, then only we understand the severity of diabetic retinopathy.
Correct.
So cataract surgery in diabetic is not same as cataract surgery in non-diabetics.
Non-diabetics. Very true. Excellent. Excellent. Great. So we've looked at the top three. Are there any other which you just want to mention, which are not in the top three, but it will be useful for the people? Yeah.
Most of the time, what happens is that patient comes to us with complaints related to vision.
Right, right.
Patient comes and says that I cannot see, I think my number has changed or something like that. So first symptom in a diabetic, if a young patient comes and says that my number is changing frequently, then I also ask that person to check his blood sugar.
Correct.
And usually if your blood sugar is fluctuating and if it is high, then also your refractive error changes frequently.
Right, right.
Second thing is that some patients, they have plus number. They require convex lens. But because of diabetes, when blood sugar is high, because of high blood sugar, there occurs certain changes in the lens of that patient, and we call it as myopic shift.
Okay.
And so patient feels that when I remove my spectacle, I can see clearly. But doctor, you are saying that I am developing cataract. So actually it is that cataract which is causing myopic shift, and that is aiding that patient temporarily. Understood? So frequent change of refractive error in younger age or even in older age. Number one. Number two, when we examine, we suddenly find that when we examine the retina, we find changes because of diabetes in the retina. Patient is unaware of that. Then we do all the investigations and then we find that your blood sugar is very high. Sometimes the diagnosis of diabetes happens in ophthalm OPD. When we do a checkup of retina of such patients. So all patients who are more than 40 years of age should at least get their eye checked once in a year from a trained ophthalmologist.
Correct. Do you want to throw some more light on the retinopathy in the image behind? I'm sure people are getting curious. Is it sun? Is it some rays coming out of the sun? ये क्या है interesting image आपके पीछे जो है? Can you just share a little bit more on that?
Yes, I will share that image. I will throw light on that image. It's an image of retina, which we have taken in with the help of fundus camera. So usually we dilate pupil and take such image. The central part, what we are seeing here, this part, is the disc or the optic nerve head. My pointer is there on this. These are all blood vessels. These are arteries and veins.
Yeah.
And these are all exudates because of diabetes.
All these golden things are called exudates.
So, let me tell you that eye is the only part where we can actually visualize our own blood vessels. Retina is a part where we can visualize blood vessels by doing examination of retina.
Correct.
And diabetes is a disease of small vessels. And in diabetes, there is an inflammation of these small vessels.
Correct.
Because of that, there is obliteration of these small vessels. And as you are aware that blood vessels, they supply oxygen to our different parts. And when the oxygen is not supplied to different parts of our body, there is a anoxia or hypoxia.
Less oxygen, correct?
Less oxygen supply. And to counter that, our body has a mechanism. The body synthesizes a material called as vascular endothelial growth factor.
Okay.
Our short form is VEGF, vascular endothelial growth factors.
Okay.
Because body has a natural protective mechanisms in our body. God has given us those mechanisms.
Correct.
Once these vascular endothelial growth factors are released, there is synthesis or formation of new blood vessels. Now, these new blood vessels are very fragile.
Right.
And they bleed. And that's how there is a bleeding in the retina. And another important point which I would like to tell all the patients is that the changes in the retina, they are similar to the changes which happen in kidney also.
Okay.
So diabetic patients who have retinopathy, they also have nephropathy.
Yes.
And luckily, we can see retina and detect the severity of retinopathy. Depending on that, we also understand that this disease is a long-standing disease and it also has caused damage to other organs in our body. So apart from kidney, it also damages heart, brain, and other structures also.
Correct. So that comes to the important question, how can they prevent it? How can they take care of it? Now Google Mata is there, so many of them would have read about retinopathy, proliferative, not proliferative. We're not going to get too much into the details of that, but how can they take care of their eyes so that they can have a long life with healthy eyes, which support them for life?
Very good question, Dr. Pramod. First thing is that control of diabetes, as we all are aware, is a must.
Correct.
But it is not that only controlling your diabetes will help you.
Oh.
You have to change your lifestyle.
Mm-hmm.
You have to do proper exercise.
Mm-hmm.
You have to take proper diet.
Mm-hmm.
Diet is also equally important. Exercise is also equally important. Stress management is important. And another most important factor is that you must get your eyes or yourself checked at least once in a year.
Mm-hmm.
Suppose doctor says that you have retinopathy, then depending on severity of retinopathy, doctor will advise you to come for follow-up checkups, either 6 monthly or 3 monthly. If it is a severe grade of diabetic retinopathy, then maybe 3 monthly.
Correct.
So that is how, if you follow all this, then there will be less problem for diabetic patients.
Any particular thing they should remember on the diet or the exercise front from your experience that you can suggest which could help better eye care? Yeah.
I think excess should be avoided. You are aware that in Marathi there is a nice proverb, "Ati tethe mati."
Hmm.
So if you do
That
take extreme view of
English.
anything,
Yeah. In English and Hindi, we'll have to just translate for the audience. Mati is mud, okay, or whatever, dust. So ati is like too much of anything. It just adds on to the dust. You kind of go down the dust.
anything you will go to dust. It is that
Yeah.
way. Ati tethe mati. So avoid doing excessive things. Excessive exercise suddenly doing can be harmful. So
Hmm.
in everything in moderation, even diet also in moderation, exercise also in moderation. Any complaint of eyes, you should not ignore. It is better to go and show it to the properly trained ophthalmologist. Get your eye checked, get your eye pressure checked, get your retina checked. And if you do all these things, then I think your eyesight will remain good throughout your life. And we want that actually. As a doctor, we hope that our patients should see well.
Correct. That's true. I mean, that's one of the biggest satisfaction you get is when they improve, they benefit, and then they give nice blessings and thanks to all that you've done to them. Excellent. So, any particular thing that you said, any eye complaint, they shouldn't take it lightly. So, any kind of alarming symptoms that you want to tell, if you are seeing like this, if this is what is happening, then quickly see the doctor. Any kind of direction for that?
It is for diabetics you are asking? Or?
Yes, diabetics.
First thing is that any change in normal vision, you go immediately to the doctor.
Right.
Sometimes, most commonly, diabetic patients, they say that I am seeing something black film in front of my eyes. That can be actually the blood which is there in the retina or in the vitreous cavity.
Oh my God.
Maybe visualizing that as a black curtain or black thing. So if you feel that way, it is a must that you should go to the doctor. If you are not seeing properly with your own glasses or without glasses, then it is better to go and check whether it is only because of change in the refractive error that you are not seeing properly, or is it something else?
These are some of the things. And I think one more very important thing which you mentioned is after the age of 40 or maybe 5 years of diabetes, depending on your age, I think a yearly check is a must because as you're seeing, a lot of the exudates and problems may not be happening at the exact point of blindness. And many diabetics, remain under this, in Marathi, I can say, "God gair samaj." They feel that, oh, there's no
Very good.
problem.
Yeah, it's a very good point which you have made. In fact, I wanted to tell you that, see, for us to see properly, there is something called as macula, which is in the center. And
Correct.
that macula is only of
behind your right ear. It's your behind your right ear right now. If you just that's it, correct.
So macula is the part with which we see, and it is only 250 microns size.
Wow.
So if the exudates or bleeding is not there in the macula, and if it is at the periphery, means at the extreme ends, then most of the times patients are unaware. They say, I have diabetes, but I don't have any visual complaints, so I will not go and check my eyes. And then they come after 4 or 5 years and then they say suddenly, now I can't see anything. So that should not happen. So I think there are certain things which we can prevent by doing proper follow-up visits and treatment. And there are newer modalities of treatments are also available. Apart from lasers, there are some anti-VEGF injections are also there, which are also good. So without hesitation, I think patient should go to the doctor and get his eyes thoroughly checked.
Okay, great. And I think retinopathy treatment, you've already talked about. Cataract treatment also, in a way, it's going to be about changing the lens. Glaucoma, they usually put some drops. So anything you want to talk about glaucoma a little bit more, please go ahead.
So the patients, they feel that cataract and glaucoma, like Kachbindu and Motibindu, are same thing. So if we operate patient of cataract, they say that my cataract operation is done, so now I will not get glaucoma. Means मोतीबिंदू काढलेला आहे त्यामुळे काचबिंदू होणार नाही. But that's a myth, these two are different things, two different things. So for glaucoma, basically you have to do certain tests that how severe is the effect of glaucoma on the ganglion cell layer and the retinal nerve fiber layer, and the visual field of vision which we check, the damage to visual field, how much it is there. So and what is the intraocular pressure. So depending on that, we decide which medicines are to be given, which medicines are suitable to the patients, and accordingly, those medicines are prescribed. And most of the times, the glaucoma is treated by medicines only. Patients feel that there is something like a surgery for glaucoma and it's a cure for glaucoma, like Rambad Upay म्हणतो ना आपण. So similar thing. So there is nothing like Rambad Upay or surgery for permanent cure of glaucoma. You can reduce intraocular pressure, but a proper follow-up and proper treatment will definitely keep your eyes healthy and maintain good vision throughout your life.
Any supplements you would suggest, or let it be done one-on-one with the doctor, I guess?
I cannot suggest blanket supplements to everybody, but in school also we are taught that papaya, carrots are good source of vitamin A and they are good for eyes. But apart from that, there are other substances also, like bilberry is there. Then there is lycopene in tomato, which is also good. If you are non-vegetarian, then again, there are certain non-vegetarian sources also, they are also good. But as I said, anything in excess has to be avoided. It has to be in proper moderation and proper dosage. And as per the guidance of your treating physician. So even the vitamin supplements or dietary supplements also should be taken according to the guidance of the physician who is treating you. Correct. As per the doctor's guidance, not on your own. You should go Google it and something start taking it. You should not do that. It is better to avoid such thing.
Correct. Wonderful. Madhyam Marg and regular checkups. Focus on diet, focus on exercise, focus on good sugar levels. Okay. And having lucky genes. All right. Which help you. These are some very, very important messages that you have shared. Anything as a parting message you want to share with all the viewers who are watching you now or will watch later? Please go ahead.
First thing is that I would like to congratulate you for this, your efforts in creating awareness about diabetes and complications of diabetes. And my best wishes to your freedom from diabetes. It's a great concept, because only medicines are not the only treatment for such diseases. Apart from medicines, there are other things also, which in past were not focused much. But now we are realizing that apart from medicine, other things like lifestyle modification, stress management, diet, all are important. So the approach has to be a holistic approach, and we are treating a patient as a whole and not an organ. So even as an ophthalmologist, I feel that I'm treating a patient and not only eye. That is the most important thing. And I wish that everyone gets a good vision throughout their life, and happy seeing to everybody.
Great. That's nice. Thank you.
Thank
Thank you
you.
so much. Happy seeing. I think that's something I'm hearing for the first time. So happy seeing and keep seeing all of us. And we'll meet you again in some other MedX series with some other expert, Dr. Santosh Bhide from Pune. One more time, a big thank you for joining into this short interaction. Thank you. Bye-bye.